Good afternoon, everyone. Welcome to Magna Wellness TV. Great program for you today. Our guest is Dr. Marty Goldstein from the Smith Ridge Veterinary Practice in New York. He's going to tell us a little bit about his background, his dealing with integrative medicine, and how he became affiliated or how he got introduced and worked MagnaWave into his practice at Smith Ridge. And so it's very exciting to have you with us today, Dr. Marty. And can you tell us a little about, just introduce yourself to the folks and tell us a little bit about yourself.
Hi, folks. Hi, MagnaWavers. So I graduated Cornell University in 1973, way back when, and holistic medicine, as it became known, was not even recognized then. The reason I got into this quote-unquote weird stuff was that I was losing my own health. It was genetically based, and I couldn't accept some of the avenues I was facing deemed that would happen by conventional medicine. Chronic degenerative arthritis, birthmarks growing in my body. The other males in my family were experiencing the same kind of maladies. So I started to search for my own health, and lo and behold, came upon the field of alternative medicine, became certified in acupuncture in 1974, then turned on to nutrition and supplementation, and it was a slow journey from then, mainly to regain my own health when we saw this occurring, and my arthritis suddenly, miraculously went away, my arthritis symptoms, and I was always very, very heavy and fat, and I lost 20 pounds in like, 8 days, just eating brown rice. Then it was like, well, something's going on here. I wonder if it would also work on animals. So we took family dogs and started to change their diet away from conventional pet food. In those days, it wasn't even the category food. It didn't even fit. It was Gaines Burgers and Top Choice, which was just harsh chemical substance that we called food. It was the only thing we bought and the only thing we sold, the only thing we fed to our own pets. Tender Vittles for cats, Gaines Burgers for dogs. And it was just amazing how the changes we started to see in animal health, allergies going away, arthritic symptoms going away, just like it did me. So that started my journey into this field of alternatives. And I've been doing it faithfully and faithlessly for 40 years. Well, I graduated 70, so it's 42 years out, so for 41 years. And it was a slow process of literally testing, trial and error. There was no one really to teach me in those days. There was a handful of other veterinarians, like Richard Pitcairn, who wrote for Prevention Magazine, and Norman Ralston, the granddaddy of all holistic vets, who was started in the 50s. But it was just trial and error, working on the patients while working on ourselves. Literally got condemned. I got ridiculed, license threatened, all of those great things that come along with applying quote-unquote greatness that is different than the norm. And what's good about things now is that all of what I stood for in the older days is now getting accepted and scientifically documented. So our Smith Ridge Veterinary Center, we have 4 doctors, including me. It's just an amazing facility in Westchester County, New York, because we've been doing this work for so long and documenting so many animals chronically ill with turnarounds that are literally miraculous. Dogs with cancer having 2-3 months to live, all of a sudden alive and well 6, 7, 8 years later, that starting to get offers of position of faculty at universities just for the documentation. And we do see literally animals from all over the United States and Canada almost every single day in our practice, because we've been doing it long enough that we've established a reputation of that level where people are driving in, flying in, or consulting with us from all over the United States. By the way, we are looking for an associate veterinarian So for any of those listening out there, if you know a veterinarian, or if you are a veterinarian that wants to work in an incredible facility, it's just, I just love going to work every day because it is just that kind of facility. Animals love coming to us. We hear that every day. Well, when she goes to the other place, she hovers in the corner and it just pees and pees. But when you pull into your parking lot, she starts to wag her tail and can't wait to run in the door. So fast forward 38, 39 years, I thought I saw just about everything that conventional medicine had to offer except the advent of new supplements that could possibly shrink a tumor. And I get exposed to this thing called PEMF and the Magna wave. And it literally changed my scope of perception about what I was doing. I've always believed that there are higher levels of healing. I've dealt with people that have dealt with some of the Eastern culture that have seen miraculous and spontaneous remissions of illnesses coming without the administration of something, just coming from a higher level of energetic healing. I believe through our physical body and our 5 senses of perception that we're limited to our universe by about 85%, where 85% of what is either hitting or affecting the physical body is outside the realm of our 5 senses. So I've always been aware of this, and then the Magna wave came along, and I experienced in my own body, and the literally hundreds of friends and acquaintances that I've treated, and especially the animals, that were on the brink of the future of medicine. And I got to tell you that after about 3 months of using this equipment, my analogy is that chamber in the Starship Enterprise in Star Trek, where if anyone had any illness at all, they went into this chamber and these magic beams came down and the illness was gone. And I've literally seen this happen with hundreds of people, maybe not hundreds, maybe many, many, many dozens, and animals that I've treated. And it's just, it flips me out every single day. And I have my own theories for it, just my 42 years of experience. I've done a lot of research on it. I know there's so much documentation in the federal government, PubMed, the NIH, making it real, not so much alternative, but real medicine. The only thing that I can't really find a reference to, except what Pat told me, is how this thing works so quickly. So I do have my own. I mean, I've taken people with frozen shoulder joints after motorcycle accidents where their shoulder blade was fused. It was broken in 8 places and fused from a body cast, and then 3 years later, they still can't move their arm greater than this, despite trying almost every therapy out there and treating for 8 minutes, and all of a sudden they lift their arm above their head and said, "What the heck was that?" So it's really changed my concept towards where I've always wanted to go in the realm of healing. And I stumbled upon this through 2 chiropractors, through a dear friend of mine who kept on bugging me about it. And literally, just to shut her up, I went to her chiropractor's house and I got treated myself. And I couldn't believe how good my shoulder felt in about 8 minutes. It was like, whoa, what is this? And then I stumbled upon someone that had a Magna wave, a friend of a friend who wasn't using it. And I borrowed it, and I started to see these same changes of good effect, good results happening in my staff, in myself, and then I treated the dogs. And it was just like, whoa. But what I did is I didn't treat the dogs with the other things that I've been using for 40 years. Experimentally, I just treated their cruciate ligament damage that flared up just with the Magna Wave. Nothing else. And it's been going on for a week. And I got a cold the next day. Not only is she running around, but she went and found her toy for the first time in a month. And it was like, uh-oh, this thing is doing even more than I'm expecting. It didn't just treat the joint. It did something beneficial to this being energetically. And through this, I stumbled upon dear old Pat Zemer. Because what I did is I twisted this guy's arm who had the Magna Wave in his closet. You got to sell this thing to me. You're not using it. You know, all these animals could benefit from it, so he sold it to me. And I said, how do I get a service and this and that? And through the chiropractors, Wendy Corin and her dear husband Dave, they said, you got to call Pat. So I called Pat. I was giving a lecture up in Boston to University of Tennessee's rehabilitation seminar, and Pat knew that I was there. He flew in. We had a couple of drinks together. I saw him treat some animals. We became the best of friends. And Pat, I want to just take my hat off to you. Oh, I got my Big Apple hat. Love this hat. Don't do webinars without the Big Apple hat.
There you go.
I take this hat off to you because I see that you're doing this at a level of responsibility that needs to happen in society for something of this magnitude to get its proper acceptance and not be, let's say, bastardized by those that are into adulterating it. So hats off to you, Pat.
Well, thank you very much, Dr. Marty. And can you tell us a little bit, when you first took it into your practice, I'm sure there was skepticism in the office, but you introduced it and you began to treat some dogs. You talked about the cruciate ligament, but just how did people respond? And just tell us a little bit about that, how that worked out.
Well, the first time I used it was on one of my receptionists. I used it on myself. I was having a field day with this thing. And I used it on my receptionist, and I said, Connie, she had an arthritic joint in her thumb, and she literally, for 3 years, just persevered with it, was taking anti-inflammatories. And what she said is every time she reached for a folder, she would get shooting pains. And I said, Connie, I have this unit here. I've not treated anyone with it. I researched it. I know there are no side effects. I've used it on myself a bunch of times. And she said, hey, I got nothing to lose. So I put it on her little joint right over there. And after 4 minutes, she looked at me. She goes, the pain's gone. And I went, really? So I continued to treat for about an 8-minute cycle. That's what I was doing in those days. And for the next 3 months, she had no pain. And I used that as a format of acceptance. Then, when I started to treat animals, what I wound up doing is talking about it, telling my experience, and usually treating the person, the caregiver of the pet first. Not charging them. Like when I graduated acupuncture in 1974, I must have treated hundreds of people with acupressure. You know, you're at a party, they got a headache, you take your little thumb out, hit a couple acupuncture points, the headache goes away. Or their stiff neck, their lower back. So I've done that for 40 years. So not treating people for money, I have no problem with a unit like this. I have a head and neck massager. When people come over, they got a stiff neck, I take the massager out and they treat themselves. So I have no problem treating with the Magna Wave. I don't care if it's FDA approved or not, just like I don't have a problem treating acupressure to my daughter when she has a headache. So I was treating the person's shoulder or their knee, and the response, 98% of the time, it was almost 100%, almost 100% predictable. I'm going to make you feel better. And as soon as they feel better, they would say, I have no problem you using this on my dog. And that's how it worked.
And you know, that's how it works almost in every horse discipline or when you talk to people, that's the thing. Show them what it does. They experience it, and then they'll let you treat their dog, because they'll do anything to keep their dogs and their cats healthy and happy. So talk a little bit about your alternative medicines and your alternative practice. You treat more than just joints. You get into internal issues. Where are your challenges there, and where have you seen some good results with that? And ladies and gentlemen, if you have questions for Dr. Marty, put them in the chat box, and we'll get right to them.
Yes. What's good about it is that I have literally treated, especially through my associates and the other hospitals using our metabolic nutritional analysis program, hundreds of thousands of patients. I've been around for 42 years. I've been a workhorse for 42 years. And when you do the numbers between the cases my associates see that I am part of, the cases I've seen, and the other hospitals that are now calling us and knocking down our doors because they've seen pets fly in, drive in from their state, it's up in the hundreds of thousands. And what's good about it is since I was very much into photography when I was at veterinary school. I won the photographic award as a senior at Cornell University because I was really into photography. So I started to photograph my cases way back in the 70s. Not because I wanted to document anything, because I was really into photography. And that documentation, before and afters, of thousands of cases, and then we would send them back into society non-invasively. Go to your original veterinarian or the special facility that gave your dog 3 months to live, and just share with them how well your dog is doing. So it was goodwill, going on and on and on. But now I'm taking those documented cases and speaking at universities and putting up diagnosis, putting up photographs of them emaciated, weighing 52 pounds, putting up biopsy reports, putting up MRI reports, putting up MRIs, and then showing how after $22,000 worth of medical therapy, they are deemed hopeless, and then showing how we either added in alternatives or added in alternatives and stopped all medication. And look at this dog photographically 8 months later, 2 years later, 4 years later, 9 years later with cancer of the throat, not diagnosed or confirmed once, but 4 times. And the universities are saying, you know, this is anecdotal, but it's proof enough, and we're into this. Acupuncture is now accepted at the level of university. Milk thistle is now an accepted nutraceutical for liver disease. Glucosamine. My license was threatened in 1978 for treating arthritic dogs with glucosamine. The sale of glucosamine products in veterinary medicine is probably well over $1 billion right now. So it's that kind of stuff that we've just stuck to prove it. And now the Magna wave has entered the scene. It is, and it has to get out there in a very sophisticated way, which, once again, hats off to Pat, that you are doing with these webinars, with the certification course, with when I tell people to call you that are interested. 11 of my clients have already purchased Magna wave machines because of how good they felt with their chronic disabilities after it. And when they call you before they purchase it, how you don't badmouth other machines that are on the market just so you can make a buck. These are the things that we have to get off the bandwagon of making health just a business so we could profit from it. How's that?
Absolutely, absolutely. Can you cite a case? I know when I was there in your office, and you had some dogs that had some tumors and various other indications that you would approach, and you also do surgery. You've kind of pioneered some of the cryogenic surgery. Is that correct? And that's been very effective. Can you give us a little background on how you merge these different therapies together as complementary methods?
Well, see that you hit it right on the head, because when I got into alternatives, suddenly all of medicine was bad and all alternatives were good. So, and I was myself still diseased at that time. So I had this pendulum that went all the way over to, oh my God, I'm degenerating, I have this and this and blah, blah, blah. And then I discover alternative medicine, my arthritis gets better. So the pendulum in a diseased state swung from here all the way over here, and then all of a sudden, all medicine is bad. And that's not true. So as I have personally matured in the field of medicine, and the pendulum is coming down to the middle, what we're in right now is the age of integrative medicine. We need conventional medicine every day to save animals' lives, so we have time to work on them alternatively. And I think it's the veterinarians that are still doing things totally alternative that are giving alternative medicine a bad name, or holistic medicine. And some of these I just have termed assholistic. And I have, because they're just being assholes about it. They're taking animals with cancer, taking them cold turkey off all their drugs, putting them on one homeopathic remedy, and saying, let's see what happens in 2 weeks, and in 4 days they're dead. It's just not proper. So what we're in right now is the wonderful world of integrative medicine. Cryosurgery, we've been doing in our practice since 1971. We are probably the foremost practice doing it, because we've taken it beyond the scope of accepted cryosurgery. If I were to show you before and after pictures of cryosurgical cases where half to 3/4 of their skull is eaten by a tumor, and you either have to amputate the entire jaw or half the head, and we go in and freeze the cancer, and the body rejects it and lays down new scar tissue. Without cryosurgery, that pet would be dead. We didn't cure anything. We just arrested the monster that's eating their head, or their rectum, or inside their ear canal, or their leg, without going through amputation. Once again, thousands and thousands of cases. The cryosurgery, besides being the only form of immune-stimulating surgery that's known, doesn't cure anything. It buys you time, so you have time to work on reestablishing the health of the immune system of the patient so they could continue to heal. Some of my most pronounced cases that I present at the universities took 2 or 3 surgeries over an 8 to 17-month period, because the cancer grew back, to finally buy us the time where the immune system supplement program finally kicked in. So now all of a sudden the cancer doesn't grow back. Some of my patients that had months to live with terminal cancer are running around 6 years later and they still have a tumor. So were we successful with the cancer? No. Were we successful with the patient? Absolutely. So it's about the patient, not the disease.
That's very interesting that you take it, and I didn't realize that about the cryosurgery. It just buys you time to then come in and use your other holistic methods, or use the Magna Wave, or the supplementation that you use, and the other medications that you can now become effective with the time. I think that's spectacular. Elaine, you have a question for us.
Yes. Jennifer is asked, have you treated dogs with discoid lupus with the Magna Wave? What treatment would you suggest? The dog is 8 years old, and it only affects the nose, and it's beginning to affect her eyes.
I have not treated this with the Magna Wave yet. I'm still short, because life is... Let me just give you an aside. I've been trying to get this message out for many, many years. I've had my own show with Martha Stewart on her radio Sirius network for 6 years. Every week for 6 years, it was going across the entire nation in Canada, and it was great, but it never caught on. I saved Oprah's dog's life. Oprah flew her dog in. Oprah had me on her show. These were ways I thought I was going to get the message out. And you know what? It just never happened. I was on Good Morning America a few times. I was just to get the message out that not only can we help these terminal animals, but what causes all these illnesses? And that's going to segue into this question. What's going on right now, and I just have to mention this, is I am hooking up with a major figure that's going to be brought back into society to help get my work out. And that figure is Roy Rogers. Roy Rogers is going to be brought back into society. It's going to be a Broadway musical. There's all his products are going to be brought back, but his humanitarianism is going to be brought back. His goodwill to society. And Roy had two pets, Trigger the horse and Bullet the dog. And they are both going to be brought back as a representation of goodness. I'm going to be hooked up as Roy's veterinarian. Both the animals are going to be in the Broadway musical, and we're going to bring the message out through that. So that was just an aside, just to tell you about this. So my life is so involved right now with this new movement. I'm not using the Magna Wave as much as I know I want to in the future. But relating to this, I see it being a very good adjunct, mainly because there's one aspect that I've documented, I've researched about the Magna Wave. The Magna Wave, we have seen a tumor shrink in 5 minutes with the Magna Wave. It blew my mind, it blew my associate's mind, and it blew the caregiver of the pet who was holding the dog as we couldn't get the Magna Wave coil over this dog's leg because the tumor was so big. So we put it on top, and after 5 minutes the owner screamed and said, "Oh my God, I think it's smaller." And then we suddenly could pass the Magna Wave coil over. It was a mast cell tumor. That led to my research where it is physically demonstrated that the area that you Magna Wave will increase the absorption of any medicinal put into the body. One research was 37% from 14 or 17 to 37%, and the other one was by 200%. So we have been very successful with discoid lupus with using nutraceuticals. My most astounding case, and she does allow me to talk to this because I don't share client information, was Cindy Lauper's dog, who came to us with discoid lupus, Cleo. It was her yellow lab. The whole nose was rotten, but Cindy was more concerned about the conventional drugs destroying her. And we got off all the drugs onto nutraceuticals, and the entire nose became normal again. So I recommend nutraceutical therapy. There is a very strong relationship to autoimmune disease and the insanity of standardized vaccinations that we do in veterinary medicine. Not that we're all opposed to all vaccines, but most animals are vaccinated with all their vaccines given at the same time every 3 years, or many every single year. And that is an insanity, especially since the dose of the vaccine has been proven to be up to 10 times what the Great Dane needs, and the same dose is given to the 2-pound Chihuahua. It's an insanity. And the link between autoimmune disease, like lupus, autoimmune hemolytic anemia, autoimmune thrombocytopenia, the link to the autoimmune processes created by the vaccines is astounding. So I think it's Jennifer, please don't vaccinate your dog again. Please get a medical exception. The only vaccine that's deemed legally necessary is the rabies, but on the package insert of every vaccine it says intended for use in healthy animals only, and a dog with systemic lupus is not considered healthy. Get an exemption for vaccine because it'll set her back tremendously. So I would use nutraceutical therapies. There is an herb put out by Seven Forest Herbal Company called Reconciling Tablets that is awesome for autoimmune disease. And one of my favorite supplements of all time is one called Beta-Thyme, which is beta-sitosterol, put out by Best for Your Pet. I don't like treating cases of this severity by internet. I think the best thing you can do is find an integrative veterinarian that you could work with that's well-versed in alternatives. Smith Ridge Veterinary Center does consults. My 3 associates do consult every single day all over the United States with the client and with the veterinarian involved in the loop. And it's very treatable, and the word cure is not a good word in veterinary medicine, but we have seen permanent remissions with this condition. And then the Magna Wave, on top of that, as we progress in the future, will, I think, have an anti-inflammatory effect to the nose and also increase the absorption of the nutraceuticals into the area.
Increase absorption, correct?
Increase absorption, up to 200%. Yes, Pat.
So basically, what she would do is treat the facial area or the nose area of the dog and the overall body to help increase the metabolism of the nutraceuticals that you're recommending, and then to hopefully get the result that they're looking for. Is that correct?
It's correct. I mean, let's just get basically simple. Man is about 10, 12, 15% conscious of the physical body. My definition of science is man trying to learn what nature already laid down. So all this technological stuff, when we get into the biochemical pathways and we're doing these CAT scans and these MRIs and these dye studies, and it's, I mean, I'm so impressed with technology, but nature already laid it down. Man cannot create an individual that can heal a cut. Nature does it automatically. So what we do is we reestablish the integrity of nature's ability to heal the body. I don't care if you call it pemphigus or schmemphigus. It doesn't make a difference. If it wasn't for his tumor, he was in great shape. Bull. If it wasn't for his heart attack, he looked really good. Bull. So the real answer, what we've been looking for, the cure for cancer. How long have we been looking for the cure for cancer? 60 years? 70 years? Intensely? Unfortunately, we're looking at the test tubes. We're looking at the laboratories. The cure for cancer has always been here. You know what it's called? Health. Well, it wasn't for his tumor, he was in great shape. No, you get a patient healthy, they will not have cancer, or they'll deal with the cancer. So all of these adjunct therapies are geared to get the immune system and the integrity of the immune system reestablished so it could do the healing. And the Magna Wave is, right now, maybe the most effective thing I've seen for creating an instant reversal of disease. Mind-blowing. I just can't wait to get more time, like with Jennifer's question, to use the Magna Wave on so many. When we saw this tumor shrink, just to let you know, these energy healing therapies, most of them are a no-no when it comes to cancer. So we were taught, don't use acupuncture with a cancer patient, especially with a tumor, because it'll drive energy towards the tumor, unless you are a master that is very well versed in the use of acupuncture with cancer. That's always been what I learned from my Chinese master way back in 1974 and 5. So I was always afraid to use Magna Wave on a tumor until I researched it. And then when I saw this tumor shrink right before our eyes, we are excited about it. One thing, the most resistant to all therapies is the osteosarcoma or bone tumor. And we are actually seeing response right now where we're Magna Waving the bone tumor as we use our other therapies of very high level intravenous vitamin C, DMSO, which is an anti-inflammatory, injectable German-based homeopathic remedies for the bone, and intense nutraceuticals. But now we're starting to see clinical evidence that these tumors are responding better by Magna Waving the tumor every single day to not only increase and enhance absorption of the stuff we're putting into the body, but the anti-inflammatory effect of the Magna Wave directly on the tumor. So it's getting exciting after 42 years having the Magna Wave enter my life.
Well, you know, and also, Doctor, from the standpoint of the Magna Wave and the PEMF improving the blood oxygen, allowing the cells to better take on oxygen, cancer doesn't like the presence of a lot of oxygen. Isn't that correct?
Yes. cancer and disease, chronic degenerative illness, will create and or grow in an area that's oxygen deplete. One of the therapies that we've been using in our practice for at least 2 decades that was being used in the 1800s in Germany is ozone therapy. Ozone, water is H2O, oxygen is O2, ozone is O3, supersaturated oxygen. And I have seen ozone injected into a bone tumor. All of a sudden the bone tumor gets really inflamed, bursts open, and shrinks down. So you're right, Pat. I got to tell you a little funny story. I had a wisdom tooth extracted, 67 years old, and I still had these stinking wisdom teeth in my mouth. So my holistic dentist, really great, super dentist, takes out the wisdom tooth, but it was so implanted after 67 years that it actually, he had to fracture a piece of my jawbone that was attached to the tooth. And he gave me 3 shots of Novocaine, and I felt my entire head cranking because it was so difficult to get this tooth out. I was afraid that my skull was going to break. So he yanks the tooth out, and I had the Magna Wave there to show him. So I take the Magna Wave out. I'm still numb as, a brain dead person. And I take the Magna Wave, it's there with me, and I put it on the area at a low frequency, and after about 7 or 8 minutes, the area is still numb, but I feel a tremendous relaxation in the unnumb area around where the tooth was taken out. I get home, the Novocaine is starting to wear off. I Magna Wave myself again. And the Novocaine wears off. There is no swelling. There is no inflammation. I eat a normal meal, but for the first time in my entire life, I didn't even feel the injection sites of the Novocaine on the nerve. It was perfectly normal. It freaked me out. So I go to my dentist and I said, if you don't get a Magna Wave, you are out of your mind. You're being irresponsible to your patients and this and that. So I'm working with him. I bring the Magna Wave back in. I treat him for his tennis elbow. Oh my God, it feels better. I treat his technician. She wants to feel it. Irritable bowel syndrome. She said, can I just feel it? I put it on her abdomen, the small coil, and it's on for about 1.5 minutes. She gets called in to a patient who has to be worked on. And she goes, oh my God, the pain is gone. It was gone for 2-3 months, from 1.5 minutes. So I'm dealing with my dentist, Dave, you got to get one of these machines. You're crazy if you don't want the benefit to your patient. And that's my dog barking. My dog blows the Magna Wave too. So when I'm talking about it, he gets all excited, Joey. So he says, yeah, Marty, finances, this and that. And I said, but, financially, you can make the money back treating your patient. He goes over to the Paracelsus clinic in Europe, where in the dental clinic, in Paracelsus, they are treating all their patients with PEMF technology. And they give them a demonstration. They take the blood out, and they look under electron microscopy a patient, and all the blood cells are dark and clumped together. They Magna Wave or PEMF the area, take a blood sample out, and instantly all the cells are red and oxygenated and no longer adhere to each other. He comes back to me and says, Marty, you're right. There's scientific evidence. Dave, get one for your patients. Well, I'm considering it and stuff like that. So you're right. It oxygenates the area, and what I'm starting to see now is that I think, and I'm sure you can speak to the effect, it's helping lay down stem cells. Period.
There's a lot of research that's being done at how the PEMF can help the generation of stem cells and certainly aid in the healing of the body with that particular effect. That's a great story. That's the fellow we had dinner with, is it not, when I was there visiting you?
Oh, yeah. That's right. I forgot about that. And he still hasn't done it. I mean, he's just, I mean, people get stuck in their ways, but he should for his patients, for his tennis elbow. But that, I mean, laying down stem cells and this and that, we're becoming so advanced in the technology of stem cells. Who created stem cells? Nature. So what we're doing is we're enhancing nature to heal, and that's what the Magna Wave does. There's no science about it. It's just the miracle of natural law on this planet, and the Magna Wave is enhancing natural law to help heal itself because of man's negative addressing quote-unquote healthcare in the medical field. There's no healthcare in the medical field. It's all disease treatment, disease diagnosis, and disease prevention using things that cause disease. What about healthcare? The Magna Wave focuses on healthcare by helping nature realign its potential magnetic forces in the body so it can do its own healing. There's no rocket science here, Pat. It's just freaking common sense. Period.
Absolutely, and it is not rocket science. I tell people that all the time. The favorite thing I say is good oxygenated blood can work a lot of miracles, and so that's the key. Just help things along, and it works out very well.
And one last thing I got to say right now, we just said that.
Okay.
It's not rocket science. Is that the original institute that did all the foundation of this, and you had the guest on, Mr. Bob Dennis?
Yes, Bob Dennis.
Worked for NASA, and that is rocket science.
Absolutely.
Rocket science is the one, and when I spoke to him, what an amazing person. And he was called in by NASA, and his goal was to do research on this technology to get rid of it because it was a bunch of hocus pocus. And he found it was so effective that he's spending his life on the study of PEMF technology. For NASA. Hello? My God.
Hello.
Yeah,
Hello.
Duh.
Yeah.
So it is rocket science.
Yes, it certainly is. Also, ladies and gentlemen, if you have any questions, if you got another question about your favorite animal or you know about somebody that's got a small animal, and this is something, Doctor, that a lot of people have always asked the question. They'll say, oh, well, you use this on horses, and they're so big and they're massive. How do we treat this little bitty dog with this device? And in my case, our little dog can fit right in the whole coil. So she'll lay in the middle of the large coil, and we'll just treat her, and it's got to be of benefit to her. So how do you, when you talk to people about that, or when you come to use this device on a cat or a dog or a small dog, how do you equate that and perform that? And ladies,
yeah, that's a great question, because the other thing I've seen about Magna Wave is that not only is it therapeutic, but it's diagnostic. It knows. It knows where the disease is, and it goes to the disease. The way I picture Magna Wave in my little contorted mind of 42 years is that disease, when an area of the body is diseased, and the basement membrane of life are these pulsed electromagnetic fields. It's a magnetic electrocurrent. When there's disease, you get an impedance to magnetic flow. So when you take something, and this is why I'll always just push the Magna Wave over all the other units on the market, is that many of these units, as Pat will verify, they will work, but you don't feel anything. And what would take the Magna Wave 8 to 10 minutes could take 40 minutes for 2 weeks in a row. You don't feel anything, but the Magna Wave is putting out a frequency so strong, it's putting out the correct pulse electromagnetic frequency, so when it hits an area of disease, there's an impedance there. When there's no disease, it goes like this, and it just flows right through. I treated an MD, because her friend bought a Magna Wave, and she brought her dog up, and I said to her, you hear about the Magna Wave? And she said, yeah, I heard about it, but tell me about it. And I said, do you have any aches or pains? And she said, my lower back. I put the Magna Wave on her lower back, and within 1 minute, she felt it in her abdomen. And she said, I've had an undiagnosed condition in my abdomen for many years. And it doesn't even show on MRI, but this Magna Wave is going right to it. And after 10 minutes, not only did her lower back feel so much better, but her abdominal pain was gone. So the Magna wave went to the source of the pathology, but the MRI couldn't. So that's how it is. So it's also a diagnostic machine. So the correct way of doing it is you could actually scan the pet's body, and you'll see, we do it right now still Western textbook. So if there's a painful area over the mid back, we'll put the Magna wave over that. If we know a dog has hip dysplasia, we'll put it over the hips. But we're starting to scan the body with the Magna wave, and when it hits an area of pathology, you'll see it starting to pulse and flinch. One case that I always brought to mind, a 6-year-old beautiful golden retriever in severe kidney failure. One of the kidneys on sonogram by a specialty facility was totally, you couldn't even see the kidney, and the other one was 80 to 90% shot. Kidney values were off the scale. They gave this dog 2 days to live. We put the dog in intravenous. We turned the dog around, but it wasn't lasting. We started to Magna wave the dog with the intravenous, thinking that maybe we could help lay down stem cells. This dog lasted 8 or 9 months before she ultimately passed, but she had two days to live. But what I saw is when I put the Magna wave coil over the back in front of the kidneys, the area of the kidneys pulsed. When I put the Magna wave over the kidneys, the area of the kidneys pulsed. When I put the Magna wave on the back behind the kidneys, the area of the kidneys pulsed. And I said, oh my God, this thing knows where the pathology is, even though I'm not putting it directly over the area that Western science knows where the kidney is anatomically. And it blew my mind. So this Magna wave, put it over here, and over here, it's still focused right where the kidneys were, where the pathology was. So that's how we're starting to use it right now, diagnostically, to scan the body, treat the area we know, but also scan the body.
Excellent. Thank you, Doctor. I believe, Elaine, we have a question.
Yes. Rick asked, Dr. Marty, have you used the Magna wave on patients or friends with heart issues like AFib?
Oh my God! I don't even know if I should share this. The sirens will come and take my license away. One of my best clients ever, Beverly. She comes up from Virginia to New York once or twice a year with her crazy German shepherds. I love this lady, and she comes up about maybe 8-9 months ago, and she went through severe Lyme disease, maybe 6 months of therapy. Intravenous catheters, intravenous antibiotics, and it left her scarred, painful, and atrial fibrillation that was not responsive to medication. She was a wreck. I love this lady. And I told her about the Magna wave, and she was just fused in her shoulder with pain and tension. And I took out the big coil in her Magna wave on very, very low frequency, just to bring her some relief. And it goes around here, and it goes over the chest, and she's feeling it. And after 1 minute, God's honest truth, she said, oh my God, I feel it in my heart. I turned the machine off because I'm going to kill Beverly. And she goes, no, it actually feels good. 4 minutes into the therapy, God's honest truth, she goes, I don't feel it in my heart anymore. Treated her for 10 minutes, takes it off, she goes, atrial fibrillation is gone. Call her the next day back in Virginia. Atrial fibrillation is gone. Pat, she purchased Magna wave. And she was facing what she told me. She was facing a risky, expensive surgery to try to correct the atrial fibrillation. And this Magna wave in 4 minutes, it's one of the cases that has blown my mind. I haven't spoken to Beverly in a while. Did it come back? I don't know.
I talk to Beverly.
Oh, you did? There you go.
I talk to Beverly all the time. She's great.
Yeah,
she loves her machine.
Yeah, she is one of my best clients. In 42 years, tens of thousands of clients. I love Beverly. And it blew. See, that's the thing about the Magna wave. is some of the things I'm seeing, even though I have seen more miraculous and documented more miraculous turnarounds of chronic degenerative hopeless cases, the Magna Wave on a daily basis continues to blow my mind. I can't wait to use it more, research it more, and document it more. Period.
Thank you very much, Dr. Marty.
Good
Elaine,
question.
questions? Another?
I have a question. This is Sandy has asked a question about a typical session on a horse. When you would start and what areas you would work on.
Okay, my answer to that, since I'm not a large animal practitioner, is the chiropractic couple that originally treated me, Wendy Corin and her great husband Dave. The day before they treated me, they were leaving for Wellington, Florida, to do an in-depth study of Magna Wave, even though the chiropractic is for humans, on horses. They treat more horses than they do people. And just the stories I've heard through them, they swear by the Magna Wave. But what I got to say is Pat's, your guys, the certification course is so in-depth on how to properly treat a horse with Magna Wave. Just get into the certification course, and there's your answer.
Yeah.
And you know, actually also, you kind of described it when you talked about the dogs, how you move the coil around the dog and you'll see issues going on, or you'll see pathology. We do the same thing with the horse. We'll start on the shoulder, we'll start on the neck, we'll move through the shoulder area, we'll go work across the top line of the back, down through the hips, and that's pretty much the routine. Neck, shoulder, top line, hips, and glutes, that type of thing, to work the upper body. And you do that, and you'll see where there's pathology, where they need some to concentrate a little bit on that area. And that's pretty much the routine. And you're correct. We have YouTube videos that show this going on and how we treat a horse, but that's the thing. And Doctor, you described it. Just move it around, kind of like I always describe it as you're brushing the horse, or you're petting the dog. So you move the coils in that fashion, and they'll work their magic and show you what's going on and where it might be.
Well, I started doing that in the dog after I did your certification course, and it just made sense. I mean, the one thing about horses, they're so big, you have big areas to work with. One thing that impressed me is when we were in Boston at the rehabilitation seminar, is you took that veterinarian's dachshund.
Tell that story. That's a great story.
Yeah, that blew not only my mind, but her mind. Why she hasn't purchased one of these, if she hasn't, is I'm clueless. But this was a dachshund that had, dachshund's nickname, or disc disease in dogs, is nicknamed the dachshund syndrome. They just blow their discs out. And this dog had multiple discs, protrusions, or ruptures, slip discs, and recovered with acupuncture, but still, I think she said for 2 years, was never 100%. And the dog would walk and be wobbly and blah, blah, blah. Pat, and this is what I learned from you, you sat this little baby inside the big coil and turned it up really high, and I watched 3/4 of this dog's body pulse. And the dog just sat there for 8 minutes, didn't move. And the entire pulse went up the entire body, and the therapy was over. I think it was 10 minutes. And the dog just bolted off. It was like, wow, she feels good. Next morning, we were down at breakfast. We went over to the vet and said, how did she do? And she said, she jumped in and out of my bed for the first time in 2 years, 3 times last night. And it was like, what? And this was more in the initial. I was already seeing miraculous stuff, but not at the level I'm seeing it now. And it just blew my mind. It was. And did she have a buying machine? No.
But that dog, if you remember, the next day we treated the dog again.
Oh, again, right.
And the dog was a world champion agility dog.
Right.
And so we treated the dog a second time. Each treatment was 8 minutes long, and that dog was running around the facility looking for an agility course. Right. And It was amazing. Now, how long it lasted? We all know that the more you treat, the longer it lasts. And so we don't know that, and we kind of lost contact there. But that really was a great story, and that was a lot of fun at that meeting, Doctor.
Yeah, and that was really good because it taught me with the little dogs, with the big coil, what you're doing is you're actually scanning the whole body. It's almost like the mat that we have. You know, I'm fortunate to have a mat with my Magna Wave, and you lay down and it just goes to the areas of pathology. My first experience with the Magna Wave, when I went over to these chiropractors, I went into their house. They were treating their patients because they were going the next day down to Florida. So I walk in there, and there was a 28-year-old kid who was in great shape. He was an athlete, but he had irritable bowel syndrome. He's laying on the mat, and I'm sitting at bedside, and they got the Magna Wave turned up about 3/4, and I'm watching his abdomen throb to a point he said, "Ooh, could you turn it down a little? It's uncomfortable." So they treated him for 8-10 minutes. He gets up, and he goes, "Wow, that feels better." They adjusted him. He left. And they say to me, "You want to try it?" And I said, "Oh, God, yes." So I go on the machine. I'm laying on the mat, and they go, "Any problem?" I haven't been sick really a lot in 35 years. I said, "No, but my right shoulder is always stiff." So I'm laying on the mat, and they turn it up and turn it up and they turn it up. And they go up to full potency, and my shoulder is throbbing. I look down at my abdomen, and I go to them. "Why is my abdomen throbbing?" Where the guy before me had half the potency, his abdomen was throbbing. And Wendy, the chiropractor, looks at me, and she goes, and she says, "Because it knows." And I got up. My shoulder felt better than it felt in 2 years. I looked at the chiropractors, and I said, "I got one favor to ask you." And they said, "What?" I said, "Please don't leave tomorrow." They were leaving for three or 4 months. Right. I wanted to get treated by this machine every day. I felt so good. But that was my first indication that, I'm dealing with something different. Because this guy who had pathology in his abdomen, that mat was pulsing his abdomen. I had pathology in my shoulder. The mat was only pulsing my shoulder. And they said, we have some knowledge. We have a basis of energetic knowledge here that I'm about to stumble on that's going to blow my mind. And it has.
Excellent. Elaine, do we have another question?
Nope, we're good. We're good.
We're good with questions. Okay, I thought we had another one. All right. Well, Dr. Marty, we're just about out of time. If anyone does have a question, please quick get it in the chat box, and we'll answer it for you before we take off. We'd like to keep these webinars to about an hour, so you can listen to it in a couple of trips to work or watch it,
yeah, right.
whatever is convenient. And so again, folks, we thank you very much for being with us. Dr. Marty, thank you for being with us. Anything in closing that you'd like to share?
Yeah, remember, we are looking for an associate veterinarian. If you know a veterinarian that wants to have their life changed 10 times for the better, have them go to smithridge.com. I wrote a book 16 years ago called The Nature of Animal Healing that's still considered kind of a bestseller. I don't care. I don't make any profit from it. But it's been selling for 16 years because it's the truth about nature. I have to update it sometimes, because it had no web sites in it, because they didn't exist 16 years ago. So The Nature of Animal Healing, it's just a really great book in demonstrating the truth about healing and the focus that medicine should be. Pat, keep up the great work. It's so great working with you, and let's just boogie and help society, two-legged and four-legged, get better, because this world needs it. We're a mess.
Thank you very much, Dr. Marty. And Elaine, thank you for being with us today and helping out and keeping everything going here with the program. And that's it from Pat's Employment Service. Don't forget, call Smith Ridge Veterinary if you're a veterinarian and you're looking to find something going. And then we'll work that out, Doctor. And so anyway, ladies and gentlemen, thank you for joining us here on Magna Way Wellness TV. We'll be back next Tuesday. And if you have a question that you would like to ask, or you have a topic that you'd like for us to cover on the program, please send me an email down, write this down. It's Pat Zemer, Z-I-E-M-E-R, rhymes with Beamer. Pat Zemer at magnawavepemf.com, and we'll certainly get after your program and get the information that you want to have with regard to MagnaWave and PEMF. So again, Doctor, thank you very much. Elaine, thank you. Ladies and gentlemen, thank you for joining us, and we'll see you next week. Bye-bye.
Thank you.